Good afternoon, everyone. I'm Yawa Samoa. Welcome to our telehealth discussion panel. We've got a great discussion teed up for you all this afternoon. Hopefully you'll enjoy the topic. It's very timely given everything that's going on with COVID. We've got two very distinguished panelists with us today. First, Dr. Tony Board. Dr. Board is a consultant OBGYN with and a clinical lead for fetal maternal medicine with the West Herts University Hospitals system in the UK. And Dr. Board has held numerous management positions within the West Herts system. He's been practicing for well over 30 years in Russia and Ghana, and obviously most recently in the UK. So he's very experienced and conversant in this topic. So we're delighted to have him with us today. And then we have Professor Heneba Boakye-Adjei, who is the founder of the Foundation of Orthopedics and Complex Spine, CEO of Focus Hospital in Accra. And Prof, as he's affectionately known, has over 40 years of experience practicing throughout most of his career at the Hospital for Special Surgery in New York. And he relocated to Ghana about 6 years ago to run the Focus Hospital full time. So we're delighted to have him with us as well. And then I serve as a board member of the Focus Hospital, and I'm also the former chairman of the Focus US Foundation, which supports the work of the hospital. So we're all delighted to be with you today. I think telehealth obviously has come to the forefront given all that's happening with COVID. But to set the stage, I think this was a very interesting growth industry even prior to COVID. There's not a lot of statistics about the platform as a whole, but if you just look anecdotally at some of the trends, if you look at Teladoc, for instance, which is the leading company in the sector, they reported that leading up to 2019, the last 5 years, from 2014 to 2019, they saw a compound annual growth rate of over 65% in terms of the number of patient visits using the telehealth platform. In 2019, they recorded over 4 million visits, so which is certainly interesting. So clearly, even leading up to COVID, this was a growth area and a platform that more and more people around the world were starting to use to access medicine. There are also other estimates. Numerous studies have been done. There are other estimates out there that over 40% of Fortune 500 companies provide some sort of telemedicine platform for their employees. So clearly this is a vehicle that can be impactful if harnessed the right way. So we're going to spend a little bit of time talking about what the implications are broadly and for Ghana as a whole. So maybe with that, I'll tee up the discussion and throw it first to you, Tony, for the first question. Can you maybe expand a little bit on the trends and the dynamics that we've seen in telehealth broadly? What do you think the key drivers are for some of this exponential growth that we've seen leading up to the current climate? What sort of drivers do you see, above and beyond COVID?
Right. Okay. Thank you, Yao. Now, I'll try and build up on what you said. As you rightly said, telehealth has probably been one of the fastest growing markets in the world economy. There's been a huge explosion of use even before the COVID pandemic hit us. In the past 12 years, it's grown from a multi-million pound industry to a multi-billion pound industry. And as of 2018, it was thought to be worth in the region of about 15 to 18 billion dollars. This COVID pandemic is likely to be a game changer, and what it has done is it has forced a lot of healthcare practitioners and healthcare administrators to look at alternative ways of delivering healthcare, and this has dovetailed into the growth in the use of telemedicine platforms in general. Prior to this, there was a huge wide variety of uses and areas where telemedicine was used, primarily teleradiology, as Prof would well know, telecardiology, telepathology, ambulatory monitoring of patients. In the UK, huge growth in the development and use of digital apps and platforms to access primary care, what we call GPs over here, where people could just, plug into access healthcare services on these platforms. The most systemic example and wide one would be the NHS 111 system, where anybody could access healthcare by just calling the 111 number, speaking to a non-medical trained person behind a computer who puts your symptoms into an algorithm and offers advice over the phone, or either offers treatment advice or advice to either attend the accident and emergency department or to go see your GP. So this, all of these, sort of have shown that I think that we're looking at the traditional models of delivering healthcare in the developed countries, and to a certain extent in developing countries, is going to change over the next few years. And we are going to look at different ways of delivering healthcare using digital platforms. That is without a doubt, that is on us, and that's the way we're going. I think that in Ghana, we are well placed to take advantage of that. Telemedicine solutions are wide and varied, some cheap, some expensive, but I think that with good analysis and good identification of the areas we want to grow, areas where we can get quick gains, there are very cheap telemedicine solutions available, which can be implemented, and if implemented in the right way, can provide huge cost benefits and huge, improvements to health outcomes in aspects of healthcare.
Great, thanks, Tony. Maybe switching over, Prof, let's get to the, I think Tony gave us a very good macro summary. Maybe let's delve into the micro a little bit. Can you give us a sense, I know at Focus, given the recent shutdown, we've utilized a lot of telehealth platforms to treat patients recently. Can you maybe give us a sense and give us an example of some of the cases you've treated recently using this platform? What worked well, what didn't work well? What were some of the lessons learned?
Well, and thank you again for inviting me to this platform and this symposium. As Tony said, telehealth is really not new. It's been in practice in the early 20th century with electrocardiogram transmission over the phone, and then in the military also. Specifically, our experiences and applications have been in e-learning, especially with a hospital for special surgery affiliation that we have. And that's something we did early on, so that we log onto their e-learning platform so we can have virtual consultations, communications, and training for our staff, especially in the physiotherapy department and the nursing department. We've been able to get the Ghana's only 2 certified neurophysiologists by using this mechanism, whereby they have had online training by the neurologist in New York and have been able to actually take the board exams and pass the exams and be certified without being physically in the United States. And moreover, because we don't have a radiologist here at Focus, all our images are on the picture archiving and communication system, which is transmitted to a radiologist at Kolebu, who then reads our images and sends us information and with diagnosis and treatment recommendations. And we also do the same with the radiologist at the Hospital for Special Surgery. We have a weekly conference using the Seattle Spine Foundation Surgical Skills Teleconsultation Program, so that we can actually have a full curriculum for our training physicians and surgeons. Now, we have established a Polycom video conferencing system here at the hospital, so that in surgery, I can actually sit in the conference room and view synchronously the procedures that are being performed in the theater, and basically advise and guide and walk them through step by step as to what should be done without being physically there. And this has become very, very practical and very beneficial for us, especially when COVID hit us, to the point where we started with a teleconsultation. So all our patients are phoned, and then information is taken over the phone. We can actually view their images with them, discuss everything with them before they even come into the hospital for diagnostics, whether it's radiography or laboratory, and then eventually are seen by the doctor, which will only take like 2 minutes because we've done all the work. And basically we'll be seeing them for perhaps a consent for their surgical procedures. So the benefits are immense, and we've seen how it has supported clinical practice at a distance, saving time and movement. And we've been able to overcome the geographical barriers connecting users who are not in the same physical location, using the various forms of information and communication technology. Now, a very good example is several years ago when I was in New York and I was actually at a meeting in Virginia. I got an email from my office in New York that there is a message from South Africa. So I looked at the message from South Africa, and then it was basically a friend who has also received a message from Nigeria about a lady who has had a spine trauma and was paralyzed. So immediately I connected with the lady, with the consultant in Nigeria. WhatsApp images were sent to my phone. I relayed that WhatsApp information to Kolebu Hospital, where I had trained one of the earliest or youngest spine surgeons. So basically, in a matter of 1 hour, we were able to have a 3-continent communication: Nigeria, South Africa, Virginia, New York, and Kolebu. And we were able to actually come up with a diagnosis. Within the next 2 hours, the lady was actually on the plane to Ghana and had surgery in 24 hours and was able to recover full function, traveled to the US subsequently for rehabilitation, and then had a master's degree and went back to Nigeria. So without telehealth, it would have been impossible to provide guidance and treatment options for this lady who otherwise would have been paralyzed. So it has immense benefits that should be harnessed by the country, especially in this era of COVID, and in a situation where we don't have the healthcare professionals or the physical infrastructure to really manage all our health needs, which will bring us to the Sustainable Development Goal 3 objective of providing healthcare for all.
That's good. And Tony, how about you? What sort of recent experience have you had with some of your patients on using this platform?
Well, I mean, nothing as exciting as Prof in linking 3 continents. But essentially, yes, I mean, leading up to COVID, we did use a lot of telemedicine platforms with regards, I mean, me providing tertiary advice to outline hospitals on fetal medicine and maternal medicine issues for complex cases, multidisciplinary discussion of complex cases with between specialists of different groups and GPs. Specific to what I have seen more because of COVID is that we're now doing a lot more video conferencing, video consultations. And in my personal practice, my face-to-face consultations have decreased by about 30 to 40%. So whereby I'm seeing you're consulting and offering medical advice to a lot more patients over the phone, decreasing attendance at hospitals. What we're doing, just like Prof is saying, is that for those who need to come to hospitals after your teleconferencing, you can organize the diagnostics. So by the time they come into the hospital, they're all well prepared and don't have to spend too much time, and they can go forward with their treatments. What we're doing a lot now recently is a lot of ambulatory monitoring of patients. So in my personal practice, ambulatory monitoring of blood pressure trends with the hypertensive disease in pregnancies, and with the gestational diabetics, monitoring of their blood sugar levels. So these patients, what they do from home is monitor they have their glucometers, which sync by Bluetooth to the apps on their phone. And then, so anywhere they are, we can access it centrally, see what their blood glucose levels are doing, and send them advice either by email or on the app as to whether to increase, decrease their insulin levels and what to do to change the management of their diabetes in their pregnancies. So that's really essentially what we are. I mean, that's how it's impacted most on my practice. Yes.
That's a pretty significant number to have 30 to 40% of your visits being done via this platform. I think is really interesting. So I think, you know, the ticket, it seems like certainly when you look at the UK, the US, the developed world broadly, this is really taken off. Maybe switching gears a little bit into Ghana, I'd love to have your perspectives, maybe starting with you, Prof, and then Tony, on, you know, are we really seeing this platform having the same type of momentum in Ghana? And if not, what are some of the challenges to getting it, to having it be more adopted?
Yeah, so what I would say is that the WHO has been tracking countries that have telehealth strategies and policies to outline the visions and objectives regarding the application and provision, as well as the control and standards and ethics related to national and international use. So we were named as one of the countries back in 2010 and 2015 that Ghana has adopted the e-health policies and strategies, which is very good. And then if we go back to about 10 years ago, the Novartis Foundation started the Ghana Telehealth program and actually came up with a Ghana Telemedicine toolkit. So it was a pilot program that started in the Amansi West District of the Ashanti region back in 2011. And this covered about 30 communities, 35,000 people. And based on the pilot program success, the Ghana Health Service selected it for implementation across the country back in 2019. So I believe this is a good start based on the pilot program success and implementation across the nation. And based on the Novartis Foundation decade of experience here, it's basically been one of the best digital health systems that have been able to actually provide healthcare using just mobile phones, for instance, to a countless number of individuals. Some of the challenges are, and this is universal, most commonly in the developing world and the low middle income countries, which were one of them, is the number one is the financial cost, you know, and the underdeveloped infrastructure and the lack of technical expertise. The developed world's challenges are usually the legal and the ethical issues about patient privacy and confidentiality, and also the complex human and cultural factors, linguistics and cultural differences between patients and service providers. But for us, the main challenge really would be the financial outlay and the infrastructure that is required, especially in the information and communication technology. Now, we're talking about 4G and 5G in the developed world. Here, we're struggling with 2, 3, and 4G. So once that becomes readily available, I think we'll be able to reach the goals that have been established and created by the Ghana health system. So those are really the main barriers, which I think the government has to take into consideration and make that a significant portion of the healthcare dollars as the budgets are prepared.
Great. Tony, any perspectives as well?
Yes, I mean, just Prof has sort of outlined most of the barriers which sort of are inherent in trying to develop a telemedicine system or telemedicine platform in a developing country. Saying again, I mean, I think one of the issues or some of the failures of telemedicine projects that have been started in sub-Saharan Africa have been that most of them have been designed for use in developed countries and haven't taken local context into account. I think that is one of the key areas when developing a telemedicine solution in a developing country, considering our wide cultural and language differences, is to tailor it into that. Talking about ICT and internet access, I mean, I think we are way ahead of the curve in sub-Saharan Africa, in Ghana. And I think this is something that we should take advantage of. I mean, I think I may be wrong, but I understand that the government has or is in the process of laying 5 new submarine fiber optic cables, which will provide really fast bandwidth internet. And their goal is to provide internet connection to 99% of the country by 2020. Probably COVID would have slowed that down a bit, but hopefully by 2022, 2023, we should be able to provide high bandwidth internet to 99% of the country, which is good news and which provides the necessary platform or for the vital platform for any telemedicine solution.
Yeah, great.
Now, so just going to add to it. So just for telemedicine, again, I think it's important that we look at simple solutions first. So simple things like using mobile phones. I mean, we all know how the financial sector has used mobile phones to provide financial services and banking services to rural and remote areas, and it's been hugely successful. And I think in healthcare, this is something we should be looking at, using that same platform, whether it's a simple way of just developing unidirectional health education messages to the remote areas in terms of health practices. I think it's something which we can get a quick win from, but so partnering with financial and the local financial and banking establishments to using their digital platforms as a telemedicine tool.
That's great. And then maybe along those same lines, Prof, if you could make any, if you think about sort of low-hanging fruit or, a wish list of policy or strategy implementations that you think could have a big impact in improving telehealth access or telehealth delivery in Ghana, what would you say?
Yeah, I think as Tony said, the platforms that are cheaper and are also very ubiquitous and user-friendly and versatile, mobile phones, social media, those are very easy to implement and to get the information through either as a store and forward format or synchronous communication. So those are available. I believe maybe 80% of Ghanaians have mobile phones. But for low-hanging fruit, we talked about the human resources. And the whole idea of telemedicine is to get healthcare delivered at a distance. If we had a plethora of specialists in every district hospital, every community hospital, it may not be as critical other than for the high-level care. But since we don't have enough physicians to 1 to 8,000 population, I think the use of diaspora physicians and specialists, for instance, is very, very, very easy to come about now that we've been able to communicate with them in an e-learning programs. We can establish a physician specialist bank for regular scheduled consulting with telehealth centers that are established across the entire country. If every district hospital has a teleconsulting center, we can easily tap into that with our physician specialists in the country and also in the diaspora as an advisory group to support this process. And they can also help with policy and strategy organization, and then help upgrade and increase the regional teleconsulting centers through the community, district, and then sub-district levels. I think this is one area that can readily be harnessed, utilizing the diaspora physicians and the specialists especially, and specialists in the country through e-learning, specialist bank, advisory group, but more importantly, strengthening the teleconsulting health centers. And that's what I think should be established. And so my wish list will be to establish more teleconsulting health centers across the country that can be tapped into by any program that is ready to deliver healthcare to the local physicians and healthcare providers.
No, I think that's spot on. That's a great suggestion. I think in some of the work we've done recently, I think one of the key areas or key obstacles that we've identified in terms of healthcare delivery in Ghana is the lack of adequate number of trained doctors and nurses to be able to help provide that care. Do you have a sense of how many diaspora Ghanaian physicians we have in the U.S. and maybe Tony, you in the UK? What's the pool of people that are available if we can have the right platform set up, we could then tap into to help deliver care in Ghana?
The recent communication with the Ghana Physicians and Surgeons Foundation in the US stated that about 2,000 Ghanaian physicians in the US alone. That's half of all the Ghanaians in the country. That's a lot. And almost all of them, 90% are specialists.
Wow, that's incredible. Tony, what about the UK?
Yeah, same thing. The numbers are similar in the UK. I mean, I think officially about 1,600 doctors, most of them specialists. I don't know about general practitioners, but we have about 1,600 specialists, Ghanaian specialists, spread out in the UK.
Okay.
And most of which would be more than willing to offer their services if required to.
Yeah, that's incredible. So,
and they wouldn't have to travel. Yeah, they wouldn't have to travel to Ghana all the time as we've been proposing. You know, coming to Ghana for 2 weeks at a time. I mean, that's good, but the same purpose can be achieved from a distance.
Right, and certainly there's significant efficiencies and cost savings that can come about when we take that approach. So I think this brings us towards the end of our session. I want to make sure we leave enough time for Q&A from our audience. But give you the last 30 seconds to each of you if you have any final thoughts. Otherwise, we can open it up for Q&A.
Yeah, the telehealth ultimatum to me is that it is a must. It's not an option. And I think to achieve its potential, telehealth should be considered an essential part of the healthcare system, just like hospital beds. And it should be numero uno in the minds of the healthcare providers, the policymakers, Ghana Health Service, Ministry of Health, and also the Ministry of Finance in their budgeting. So we can increase the healthcare expenditure from 3.5 to hopefully 7, 8, 9, or 10, making telehealth budgeting a significant part of this agenda. The goal is universal healthcare, and you can't reach universal healthcare and achieve your Sustainable Development Goal 3 if you can't reach everybody and make healthcare accessible.
Great. Tony, final word?
I fully agree with that. Now, probably what I'll just add to it is that I think COVID has brought along a lot of awareness, especially in the private sector. Now, the general feeling is that the private sector now is much more willing to invest in healthcare, having seen how an unhealthy population, how COVID has negatively affected economies. And there is that realization in the private sector that about the strong link between a healthy population and income generation or wealth generation. So I think that with the private sector now more willing to enter into private-public partnerships in healthcare development is something which, probably especially in Ghana, we should try and tap into and ride the wave and use that to develop, as Prof said, our telemedicine facility centers along, that'd be my final goal. So tapping into the private sector, I think we'll be much more willing to put money into healthcare.
Okay, great. Thank you all for those brilliant insights, and I think we can now open it up to Q&A from the audience. Hi, good afternoon again, everyone. Hope you enjoyed that insightful discussion. You should all see a poll that just popped up on your screen. If you wouldn't mind just taking a few minutes to fill out the poll, that would just we just want to get a sense of who's in the audience and what sort of participation and interest we're likely to get from a Q&A perspective. So if you wouldn't mind just taking a minute to fill that out, that'd be great. And then as questions come up, please feel free to use the chat, and we'll endeavor to try to answer as many of your questions as possible. Okay, so it looks like we've got a really good diverse group, about 25% government officials. We've got a fair number of investors as well, and entrepreneurs, and then a good mix of civil society students as well. So that's a pretty good audience to start with. So maybe I'll kick it off. Tony, I see you're on. Prof, are you on? You have Dr. Bachi on? Maybe let's just give it a second while we wait for Prof.
Yeah, you have to ask Prof to unmute.
Well, if you're okay, Prof, you're good.
Yeah, unmute me.
We can hear you.
Do you hear me?
Yeah, we can hear you. Okay, so there are a number of questions that have already come in via email, so maybe I'll kick off with some of that. We've got a question with respect to where we sort of ended the discussion. Prof, you spent a lot of time talking about the diaspora and mobilizing the diaspora through this telehealth platform. There's a question with respect to how do we actually formalize this? What are the incremental steps we can actually take now in order to bring this to fruition and achieve some of these goals? Maybe I'll kick it off to you to start with some points on that.
Sure, good question. I think this can be done in consultation with the diaspora physicians, physicians and surgeons foundations, and the group in Europe. Basically, by communicating with them and meeting with them, we can draw up plans for definitely getting the database of the specialists, which we have an idea of. Also mapping out the same in the healthcare institutions in the country and where help is needed, so that a schedule can be drawn up as to who needs what type of help, and also a curriculum, in addition to basically medical diagnosis and treatment platforms. But this will require a collaborative effort between the Ghana Health Service, the diaspora physicians, and then the institutions in the country to be able to come up with a solid plan. Of course, putting in place the necessary infrastructure to also be able to achieve that seamlessly.
Good. Tony, any thoughts on that?
People are, the GPSS people are pretty ready for this kind of activity.
Good. Tony, any thoughts on that?
I mean, Prof has summarized it perfectly. It's about a start point and creating a strategic partnership between all the different organizations, both locally in Ghana and in the diaspora.
And are there, along those lines, are there any sort of practical issues such as licensing, barriers to be able to get doctors in the diaspora to be able to effectively practice in Ghana that we can sort of address or streamline to help move this process forward?
Yeah, those barriers are more prevalent in the developed world, but that's not something we should overlook. Certainly, we don't want malpractice. Somebody has to be responsible for the care and the advice that is being given. So I think this will have to come from the Ministry of Health and the Ghana Health Service as to the legality and the coverage that will be accorded the participating specialists. But I think that certainly can be worked around. Certainly, patient confidentiality is very important. HIPAA compliance is very critical, but these are legal issues that can easily be worked out. If somebody is going to give, and of course, licensing can easily be done by submission of CVs and practice patterns and experiences and country of residence licenses for reciprocity. I think this can easily be worked out. It should be the least of the barriers.
We have another question on, again, the diaspora topic, which people seem to be very interested in. Are there any plans to tap diaspora physicians to also play a role in the training of our medical students, which is obviously a pretty important factor in building our pipeline of professional resources in the healthcare space? So are there any plans to use the diaspora to help in the education of our medical students?
I'll take this one.
Yep.
Yeah, okay. I mean, I think it's all about the initial organization, and I think the will is there. to provide all forms of collaboration with healthcare facilities in Ghana. Now, telemedicine and telehealth is not just about treatment, it's about education, it's about providing treatment, it's about primary prevention, it's about public health messages. And with the start of any conversation, all these should come into the organization of it, whether it's education or whether it's provision of acute care. I think out here, I can talk for the physicians here in the UK, and I'm sure the same holds for physicians in the US. There is a big will and willingness to help in whatever shape or form, whether be it teaching of medical students, be it providing support to specialists in training, in whichever way or form. And going along digital platforms would be an easy way to regularize and help provide whatever developments are out here to be introduced back into healthcare systems in Ghana.
What about, and maybe Prof, you can take this one. What about, we spend a lot of time talking about the shortage of doctors, but what about physician assistants, nurses? What gaps exist in those areas, and how can we also, what sort of plans can we put in place to help address that to further supplement healthcare delivery in Ghana?
Yeah, unlike the physician population ratio, disparity in the country is a little different on the nursing side. There are a lot more nurses for medical practices. Most of them are clinical nurses. Very few nurse practitioners. So this is also an area that can be extended by the participation of the diaspora nurses. There are nursing groups in the US that I'm aware of. Most of them are nurse practitioners, and I'm sure the same exists in the European countries also. So the format that is laid out for physician can easily be translated into the nurse practitioner aspect of this. And having so many nurses in the country, it's like something like one nurse for every 500 or so population, which is a significant improvement. And if you compare to the one physician for something like 8,000 individuals, which doesn't meet the World Health Organization standard of one physician for 1,100 people. So the next area is pretty good, and I think that can also be taken care of in a similar manner as the diaspora physicians' participation. This will require not only the Ghana physicians and surgeons, or the Ministry of Health or the Ghana Health Services, but also the Ghana College of Physicians and Surgeons. There is the Nurses and Midwives Council also. So similar collaborative efforts can take place between the diaspora nurse practitioners and the Nurses and Midwives Council team members.
Tony, there's a question on financing. I'm going to put you on the spot a little bit. Obviously, you're a doctor, not a banker, but there's a question with respect to what sort of private financing models might be available or could be explored in Ghana for telemedicine. Perhaps maybe you've seen something in the UK, for instance, that could be applicable, but if you could maybe address that, that'd be great.
Okay, now, in terms of financing and investment, probably what I'll start by is saying that, looking at Ghana, let's take Ghana for example. Ghana is one of the fastest growing economies in the world. Now, on the back of that, investors obviously are interested in what kind of investment opportunities will be there. Now, with looking at telehealth and telemedicine, if properly structured, there are investment opportunities. So some of the drivers which I think are important here for investors, obviously any investor is going to want some element of guarantee that they will at least get back some returns on their investment, without a doubt. Ghana has put in place a lot of structures in terms of regulatory and governmental support to encourage the telehealth and telemedicine environment. Now, with that, you tend to have the payer. So these are international developmental agencies willing to come in. The whole reason why telemedicine projects tend not to last, or there's a reluctance, is about its sustainability. Now, if those conditions are in place for the international developmental agencies, together with government support, both financial and otherwise, and the right regulatory climate, you are much more likely to have the private sector, which is the pharmaceutical industry, who I know are very keen, because they get a lot of data, they get a lot of support in terms of their stocks, in terms of feedback from the drugs and everything, and we'll be able to do that on the telemedicine platform. So the private sector, which are the telecoms operators, the pharmaceutical industries, the digital industries, they will be willing to come in, they will be willing to put money in to keep these projects sustainable. So I think we've started well in that Ghana has created a good foundation in terms of governmental support. I mean, we know that Nana Akufo-Addo is one of the, I think, the co-chairs of the SDGs, the United Nations SDGs advocates. So they've created a good environment and for the development of telemedicine solutions in the country. What we need is all-round strategic partnerships, a strategic approach by a wide sector of stakeholders. There's governmental, non-governmental agencies, the private sector, the community leaders, doctors, users, everybody coming around and drawing up a proper strategic telemedicine approach. With that, the investment community, the private sector, would have more reassurance and be much more willing to pump money into the system to get it going once and for all. There's huge gains to be made. There's money to be made from the investment sector. All they want is the right condition.
That's very helpful. One of the things we've talked about in our earlier segment was infrastructure. Obviously, I think we all agree, and most people on the in this call agree, that infrastructure is it's a very important component of being able to deliver on a telehealth agenda. But I think we also recognize that, particularly in the remote and very rural areas of Ghana, some of this infrastructure doesn't exist. And so in those instances, maybe Prof, you can tackle this one. What would be your recommendation if you were speaking to the Ministry of Health, for example, in terms of how that should be tackled? How do we deliver telehealth services to citizens in the remote and rural areas where the infrastructure issues may be much more pronounced?
Yeah, so a very good question, and that's one of the barriers that I mentioned, the information and communication technology aspect of it. So internet is very critical. Nowadays with mobile devices and tablets, it's very easy to get even low bandwidth messages across, and it could be basically receive, store, and forward, such as email, WhatsApp. I mean, about half of Ghanaians, or maybe more than that, on WhatsApp now. And you can use that platform very easily, communicate with, as long as there's an interface or a platform developed well to connect the physician and the patient, that can easily go through the mobile device systems. That's the first thing. And then I think district hospitals should have an infrastructure established in a central location, whereby messages can go through that location and be distributed to either the physicians in the hospital, whether it's during their clinic time, and then relay to consultants, specialists, wherever they may be, regarding a particular problem that may come across their desk. So I think the information and communication systems are the key for the district and sub-district hospitals. And their mobile technology is very, very easy to get messages across if the platform is built well. And this is where the investment should be made.
But does that mean, though, that the type of care that you can deliver is going to be very sort of basic and rudimentary, because you're using WhatsApp and you're really just sort of sending messages back and forth?
So you're basically addressing one, appointments can be done easily that way. Two, information about patient care or patient medical condition can also be obtained that way. And then 3, diagnosis can also be obtained by sharing information on laboratory data. Laboratory data doesn't need a huge platform. Radiological data doesn't need a very huge platform. It's picture, shoot, store, and forward. So those can easily be obtained. So by the time you actually get to the crux of the matter, you have enough information to share with whoever the primary care physician is. And it could be a complex medical issue that with the appropriate information shared between the consultant and the local physician who is also connecting to the local patient, much of the decision can be reached at the point where a medical diagnosis can be made and treatment of it, or second opinion. When it comes to procedures, that's a whole different ballgame. There you need very advanced systems where video can take place, because then you have to see. You can do simulation training on video if you have good high speed or good broadband. So the surgical specialties will be the challenge, because that requires technical involvement. But with the e-learning programs that are available, procedures can be learned online very easily, and then they will have to be accompanied also by establishment of laboratories like Da Vinci laboratories, whereby surgeons can then go in and do special trainings, procedures on cadaver, and can be instructed also via video by experts who will be instructing them on how these procedures are performed. And this is done very easily in the United States. There are a lot of Da Vinci labs where physicians will go, they will watch a video, and then they go right down to the lab and they practice in it. But that's the advanced level. But for most medical consultations, you can reach a lot of the decision making via these very easily available and handy platforms that everybody has. The institutions themselves will have to have advanced systems to allow them to communicate appropriately and store data. They'll have to have a very good health information system, electronic medical records, because you need the data to be able to follow up as to the outcomes of the treatment.
Tony, any thoughts, any quick thoughts you want to share on that as well?
But, yes. Now, apart from what Prof said, we should also remember that we want to look at provision of basic healthcare, and not only acute, but also health information. Probably in my area, looking at things like maternal mortality rates, which is one of the goals of the United Nations Sustainable Development Goals. Ghana has done very well in reducing our maternal mortality. We've halved it in the last 12 years, from about 600 deaths per 100,000 live births to about 300. And that the same has gone for reducing our neonatal mortality rates and for under 5 mortality rates. These have been done using traditional approaches, healthcare approaches. I think we have done as much as we can. Using telemedicine and telehealth platforms, most of these interventions have been done in rural areas. A woman in urban areas, a woman in a rural area is 3 times more likely to die than a woman in an urban area. By now focusing, using telehealth platforms to get messages out into the community, into the rural areas and remote areas, that is very simple messages about just safe birthing methods, about reducing how to easily manage hemorrhage, which is one of the leading causes. We can further reduce our maternal mortality rates from 300, where it is now, to the Sustainable Development Goal of 70 per 100,000 women. And that goes with all the other indices of the goals which Ghana is trying to achieve, or Ghana will achieve, if we plan properly. So that would be my take on it, using these just to get low-hanging fruit, simple fruit, which need simple, low-cost solutions. And as Prof said, the store and send, using unidirectional SMS messages, WhatsApp messages, emails, yeah.
We had an interesting question that just came in on email. There's a comment that, obviously with the increasing usage of telemedicine globally, and especially in Ghana and other parts of Africa as well, it creates some vulnerabilities in the system. people who are, it gives an opportunity or a platform for people who are criminals or fraudsters who are looking to potentially peddle bad medical advice, sell bad medications to unknowing populations and profit from this whole exercise. What sort of advice can we give to the public on how to avoid such outcomes? And maybe Tony, you can take that one. Fake medications, fake health advice, things that basically lead to really bad consequences for the public.
Okay. Yeah, I mean, that is already inherent because around the world, everybody knows about WhatsApp being used as a platform for fake news, not only for general issues, but also for medical issues, especially with COVID. How many different types of concoctions and measures did any of us ever come across? And most of them were totally false and dangerous. It would be difficult to stop with the liberties we get with WhatsApp, where anybody could use the platform to be able to stop it completely. But if we have official public messages which everybody trusts, people are going to be more likely to incline towards using these platforms and ignoring the non-official platforms which currently are, I mean, people, most herbalists and other people tend to use at this present time. So it's about setting up official channels and getting people to trust them and use them.
Yeah, what I will add is that, it's like direct-to-consumer advertising, whereby a company says this medication is such and such and such, but at the end they say consult your doctor. Okay, it may not happen here, but that can easily be an avenue where infiltrators can come into the system. But I think if there is a good public service announcement and general education, public health education carried forth throughout the country, people can be made aware of what information is good or bad. So the information can be censored. You can also have certified data say that individuals should not take advice from other individuals. It has to come from a legitimate source. So if you have teleconsulting centers in the sub-districts, a patient can only take the advice of a physician, and everyone should be assigned maybe a personal physician so you know who the message is coming from. So it's a matter of organization and making sure that we try to avoid the kind of direct-to-consumer advertising or information sharing program that is rampant in other parts of the world. But it certainly is a threat, but with proper strategy and policy laid out, it can be overcome.
So I think we're approaching the end of our allotted time slot here. So I'll throw out one final question for both of you, and it's probably a little bit broader than telehealth. The government has announced a pretty ambitious plan to build up to 88 new hospitals all over the country, targeting many, many districts as a way to boost our infrastructure and capacity on the back of COVID to be able to deliver better healthcare. Any thoughts on that? If you had an opportunity to give some advice as to how this should be shaped, what would you say? What would you advise?
It's an ambitious program. The question is who are going to be the individuals running the institution with the death of physicians in the country. We're basically going to be sort of moving physicians from one location to another to the point where physicians will be 7, 3, 4, 5 hospitals. But I think it has to be done hand in hand. The manpower development program has to occur at the same time as we are developing infrastructure. We may not be able to develop physicians at the same speed, train them at the same speed with the experience and the proficiency as you're building an institution. You can build an institution in a year, but it takes 10 years to really train a specialist. So the plan has to start now so that 5 years from now, when these institutions are all built, that the requisite manpower is available. But whilst we're doing that, this is where telemedicine can play a role. If the proper technology is put in place at these institutions such that these teleconsulting health centers are present that can be tapped into by physicians at different distances. So even Kolebu physicians can take a day to do teleconsulting for specific institutions. So let's say we have sub-district ABC, and there are no general surgeons, there are no OBG, there are no infectious disease, plastic, or cardiology. At least a clinic can occur via teleconsulting once a week to an institution by a specialist in Kolebu. The same thing can be done by a diaspora physician specialist also. But then as an investment should be made into establishing very strong teleconsulting infrastructure in these institutions, tapping into the distant specialists in the country and outside until we are able to produce them on the ground.
Tony, final word?
Yes, final word. Yes, adding to Prof's, just expanding on the lack of resource. Prof mentioned it earlier on in one of his answers, talking about the use of nurse practitioners and nurses and physician assistants. It's going to be difficult, if not impossible, to staff these 77 new district hospitals and maintain the staffing. So it's about, it is easier and quicker to train nurse practitioners, easier and quicker to train physician assistants whose level is about that of a junior doctor. Now, with these people managing sort of the more remote areas, support can be given by using telemedicine platforms and telehealth platforms very, very easily. That's one. Two, my concern about that would be about identifying funding for sustaining these hospitals, because it does cost a bit for ongoing sustainability of these hospitals, which may impact on provision of healthcare, elsewhere. But if this is going to go along, and is Nana's wish that it goes along, then it is crucially important that in each of these district hospitals, telecenter is established, which it doesn't matter how complex it is. It could be simple solutions, but from which support can be given to these district hospitals, especially those where they don't have a resident doctors.
Okay, great. Well, thank you both for those very insightful remarks. I think, first of all, we appreciate your time. Both of you are very busy having schedules with surgery and so on and so forth. So we appreciate you taking the time to join us to do this panel today. I think your comments are very insightful, and I think Ghana is very lucky to have practitioners of your caliber thinking about these issues and thinking about how to take us forward. And hopefully we can make some practical progress and achieve some of the low-hanging fruit you have all laid out as we look to beef up our telehealth presence. So thank you again. So Jerry, I'll turn it back to you.